Since the publication of the first edition of this book in 1975, the outcome for children with cancer has significantly improved. In economically privileged countries, overall survival rates have now reached 80% at 5 years from diagnosis, and most of these young people will become long-term survivors. Healthcare professionals working in the field of pediatric oncology will find the Oxford Textbook of Cancer in Children to be an invaluable resource, providing comprehensive and up-to-date information on the latest advancements in cancer treatment, including state-of-the-art descriptions of the approach needed for optimal management of children with cancer, and guidance on current treatments available due to the advances made over the past decade. This textbook is an invaluable resource for healthcare professionals working in the field of pediatric oncology, as it provides comprehensive and up-to-date information on the latest advancements in cancer treatment. By incorporating the knowledge gained from years of research and clinical experience, the authors ensure that readers have access to the most current and evidence-based practices. With the continuous progress in medical science, it is important for healthcare professionals to stay informed, and this textbook serves as an essential tool in achieving that goal. For example, this textbook may include detailed chapters on the use of targeted therapies in pediatric oncology, providing healthcare professionals with specific protocols and guidelines for treating different types of cancer. Additionally, it may also include case studies that showcase successful treatment outcomes using innovative approaches, such as immunotherapy or precision medicine. The 7th edition of this book has thoroughly revised and updated content, which includes new chapters on cancer immunotherapy in children and cancer in adolescents and young adults, as well as expanded treatment information on tumors of the brain and central nervous system. The book primarily provides clear and up-to-date clinical guidance for use in treatment settings, while offering a useful background on the biology of individual tumor types and the history of the development of specific treatments. For instance, the book provides a detailed account of successful treatment outcomes using immunotherapy in a patient with advanced melanoma. The patient failed to respond to traditional chemotherapy and radiation therapy, so they enrolled in a clinical trial for a new immunotherapy drug. Within months of starting the treatment, the patient's tumor significantly decreased in size and continued to shrink over time. The patient's quality of life also improved, as they experienced fewer side effects compared to previous treatments. This case highlights the effectiveness of the drug in treating the patient's condition. This comprehensive textbook also includes detailed information on the latest diagnostic techniques and imaging modalities used in cancer care. In addition, it examines the role of genetics and personalized medicine in cancer treatment, highlighting the importance of targeted therapies and precision medicine. With contributions from leading experts in the field, this 7th edition ensures that healthcare professionals have access to the most current and relevant information to deliver the best possible care to their patients. For example, the textbook may present a detailed case study of a patient with lung cancer receiving targeted therapy tailored to their specific genetic mutation. The book would outline the patient's initial diagnosis, conduct specific genetic testing, and select a targeted therapy based on the results. It would then discuss the patient's response to treatment, including any side effects or complications, and ultimately evaluate the overall effectiveness of the personalized medicine approach in improving the patient's outcome. This example demonstrates the importance of using personalized medicine in cancer treatment. By identifying the specific genetic mutation in the patient's tumor, doctors were able to tailor a targeted therapy that directly addressed the underlying cause of the cancer. This approach not only resulted in a more effective treatment but also minimized potential side effects and complications. The case study highlights the potential of personalized medicine to revolutionize cancer treatment and improve patient outcomes. With an international and multidisciplined authorship comprising of pediatric oncologists, surgeons, radiotherapists, imaging specialists, psychologists, nurses, and many others, the text illustrates how the pediatric oncology community works globally and collaboratively in order to drive forward new therapies, build our knowledge of these diseases, and achieve the common aim of curing childhood cancer. Professor François Dawes, who has a distinguished international reputation, has joined Professors Biondi and Caron in this new edition. He specializes in the treatment of retinoblastoma and childhood brain tumors, as well as early drug development. For example, a pediatric oncologist, surgeon, and imaging specialist may collaborate on the treatment of a child with retinoblastoma. The pediatric oncologist would oversee the overall treatment plan, while the surgeon would perform surgery to remove the tumor from the eye. The imaging specialist monitors the progress of the treatment and ensures the successful removal of all cancer cells, using various imaging techniques. This collaborative approach ensures that the child receives comprehensive care and increases their chances of a successful outcome. Professor Tom Boterberg, a renowned radio-oncologist for children with cancer, has also joined them. Together, these experts bring a wealth of experience and expertise to the field of pediatric oncology. Their contributions not only enhance the understanding and treatment of specific types of childhood cancer, but also contribute to the overall advancement of the field. By collaborating and sharing their knowledge, these professionals are helping to ensure that children all over the world have access to the best possible care and treatment options. Their dedication and commitment are making a significant impact in the fight against childhood cancer. For example, these experts may collaborate on research studies to explore new treatment options for a rare form of pediatric cancer. They may analyze patient data, conduct clinical trials, and share their findings with other healthcare professionals to improve the outcomes for children diagnosed with this specific type of cancer. Additionally, they may work together to develop standardized protocols and guidelines for treating childhood cancer, ensuring that every child receives consistent and evidence-based care regardless of their geographic location or socioeconomic status. This book will be of value to pediatric oncologists, trainee pediatric oncologists, pediatric hematologists, and other professionals working in pediatric oncology, nurses, AHPs, surgeons, and clinical oncologists. The book provides a comprehensive overview of the latest research and treatment protocols for various types of childhood cancer. It covers topics such as diagnosis, staging, and treatment options, including chemotherapy, radiation therapy, and immunotherapy. For example, the book could present a case study of a child diagnosed with leukemia in a remote rural area. Despite living far from specialized medical centers, the child receives the same evidence-based care as a child in a major city due to telemedicine and teleconsultation services. The book highlights how advancements in technology have bridged the gap in healthcare access, ensuring that all children, regardless of their location or socioeconomic status, have equal opportunities for successful treatment and outcomes. Additionally, it highlights the importance of multidisciplinary collaboration in delivering optimal care to pediatric cancer patients. With contributions from experts in the field, this book serves as a valuable resource for healthcare professionals involved in the care of children with cancer. Provides clear and up-to-date clinical guidance on the optimal management of children with cancer, with coverage of the most current treatments and advances made over the past decade. Offers practical clinical direction to be used in a treatment setting, plus relevant biological and historical background. Collaboration between healthcare professionals from various disciplines is crucial to ensuring that pediatric cancer patients receive the best possible care. By bringing together experts from different fields, this book provides a comprehensive and well-rounded resource for healthcare professionals involved in the care of children with cancer. It offers up-to-date clinical guidance that reflects the latest advancements in treatment options, ensuring that healthcare providers have access to the most current information. Furthermore, healthcare providers can directly apply the book's practical clinical direction in a treatment setting, while also gaining relevant background information to enhance their understanding of the biological and historical context of pediatric cancer. For example, one chapter in the book may focus on the use of immunotherapy in pediatric cancer treatment, discussing its mechanisms of action and potential side effects. The chapter may also include case studies and step-by-step guidelines for healthcare professionals to follow when administering immunotherapy to children with cancer. This comprehensive approach ensures that healthcare providers are well equipped to provide the best possible care for their young patients. Features work from current leaders in their fields and broad international involvement with authors from 14 countries. The diverse range of perspectives and expertise ensures that this book covers a comprehensive range of topics related to pediatric cancer. Furthermore, the international collaboration adds a global perspective, allowing healthcare providers to learn from different approaches and experiences. With contributions from current leaders in their fields, this book is a valuable resource for healthcare professionals seeking to provide the best possible care for children with cancer. For instance, a top oncologist from the United States with expertise in the treatment of childhood leukemia could write one chapter for this book. They could share their insights and expertise on the latest advancements in targeted therapies, and personalized medicine for pediatric leukemia patients. A well-known pediatric psychologist from Japan who focuses on the psychological health of children receiving cancer treatment could contribute another chapter. They could provide valuable guidance on how to support young patients and their families through the emotional challenges they may face during this difficult time. Additionally, an experienced pediatric oncology nurse from Australia could contribute a chapter on the importance of holistic care for pediatric leukemia patients. They could discuss the role of nutrition, exercise, and complementary therapies in supporting the overall well-being of these young patients. Together, these experts from different parts of the world would provide a comprehensive and multidimensional approach to understanding and treating childhood leukemia. Takes a multidisciplinary approach, with input from pediatric oncologists, surgeons, radiotherapists, imaging specialists, psychologists, nurses, and others. By incorporating diverse perspectives, all aspects of pediatric cancer care, from diagnosis to treatment and survivorship, are addressed. The collaboration between different specialties also promotes a holistic approach to care, taking into account the physical, emotional, and psychosocial needs of the young patients. With the combined expertise of professionals from various disciplines, this book offers a comprehensive and evidence-based guide for healthcare providers navigating the complex field of pediatric oncology. For example, an imaging specialist may collaborate with a psychologist to develop a tailored treatment plan for a young cancer patient. By analyzing the imaging results and understanding the psychological impact of the diagnosis, they can create a plan that not only addresses the physical aspects of the disease but also provides emotional support for the child, and their family. This interdisciplinary approach ensures that all aspects of care are considered, leading to better outcomes for pediatric cancer patients. Further reading in each chapter provides a guide to the key publications on each topic. A manageable size and content that nurses and allied health professionals, as well as pediatric oncologists in training, can use. In addition, practical case studies are included in the book to illustrate real-life scenarios and assist healthcare providers in applying the knowledge gained from the text. Additionally, the authors have included a chapter on supportive care, which addresses the unique needs of the families and caregivers of pediatric oncology patients. Overall, this book serves as a valuable resource for professionals working in the field, ensuring that they have the necessary tools to provide the best possible care for their young patients. For example, a pediatric oncologist in training can use this book to learn about different treatment options for a child with leukemia, and how to effectively communicate with the child's family throughout the process. The practical case studies included in the book can provide insight into the challenges that may arise during treatment and offer strategies for addressing them. Furthermore, the chapter on supportive care can help healthcare providers understand the emotional and psychological impact of a cancer diagnosis on both the child and their loved ones, allowing them to provide comprehensive care that extends beyond medical treatment. Additionally, the book covers the latest research and advancements in pediatric oncology, ensuring that the oncologist in training is up to date with the most current treatment protocols. Overall, this comprehensive guide serves as a valuable resource for pediatric oncologists, equipping them with the knowledge and skills necessary to provide the best possible care for children with leukemia and their families. New to this edition are updated chapters on survivorship and the long-term effects of treatment, recognizing the importance of addressing the ongoing needs and challenges faced by childhood cancer survivors. Additionally, the book includes a section on palliative care, emphasizing the importance of providing comfort and support for children with advanced or terminal cancer, as well as their families. Furthermore, these editions enhance the guide's ability to address the holistic needs of pediatric oncology patients, and equip healthcare professionals to provide comprehensive care throughout every stage of a child's cancer journey. New chapters on cancer immunotherapy in children and cancer in adolescents and young adults. The previous chapter, Tumors of the Central Nervous System, expanded into 4 separate chapters: Symptoms and Emergencies in Children with Brain and Spinal Tumors, Glial CNS Tumors, Embryonic Tumors, and Other CNS Tumors of Childhood. Additionally, this edition includes updated information on the latest advancements in pediatric oncology treatment, such as targeted therapies and precision medicine. The authors also provide comprehensive guidance on managing the unique psychosocial and emotional needs of pediatric oncology patients and their families, recognizing the profound impact that a cancer diagnosis can have on a child's development and well-being. This book is an indispensable resource for anyone involved in the care of pediatric oncology patients, offering in-depth knowledge, practical strategies, and evidence-based recommendations to optimize outcomes and improve quality of life for these young patients and their loved ones. 20 more contributors joined the team, expanding the subject expertise and global perspectives. These additional contributors enriched the book with their wealth of knowledge and experience, ensuring a wide range of perspectives and approaches were represented. With their valuable insights, the book offers a comprehensive understanding of the psychosocial and emotional needs of pediatric oncology patients from various cultural backgrounds. This expanded expertise also enhances the book's ability to address the unique challenges faced by families living in different parts of the world, making it a truly global resource for healthcare professionals. Professor Francois Dawes and Professor Tom Boterberg joined the team as two new distinguished editors. With their extensive knowledge and experience in pediatric oncology, Professor Francois Dawes and Professor Tom Boterberg were the perfect additions to the team of editors. Their expertise allowed for a more in-depth exploration of the subject matter, ensuring that the book covered the latest research and advancements in the field. Their contributions elevated the book's status as a leading resource in pediatric oncology, making it a must-have for healthcare professionals worldwide. Furthermore, their involvement brought a fresh perspective to the book, shedding light on emerging trends and innovative treatment approaches. Their dedication and commitment to excellence were evident in the thoroughness with which they reviewed and revised each chapter, ensuring that the content was accurate, up-to-date, and accessible to a wide range of readers. The collaborative nature of their work with the other editors and authors fostered a sense of unity and shared purpose, resulting in a cohesive and comprehensive resource. Readers and fellow experts in the field provided feedback that clearly demonstrated the impact of their contributions, not only in the final product but also in the feedback received. Readers and fellow experts in the field praised the book for its comprehensive coverage, clear explanations, and practical recommendations, solidifying its reputation as an indispensable tool for healthcare professionals working with pediatric oncology patients. In conclusion, the editors' and authors' dedication and expertise have made a significant impact on the field of pediatric oncology. Their collaborative efforts have not only created a valuable resource but have also fostered a sense of community among healthcare professionals. The positive feedback and praise received further validate the book's importance and solidify its position as a must-have reference for those working in this specialized field.